Today's session is titled The Use of FHIR APIs to Fight COVID-19 in Ontario, Canada. The recording and the Q&A following is with Igor Sirkovich, Senior HL7 FHIR Implementation Consultant and eHealth Interoperability Solution Architect with FHIR.
Hello everyone, my name is Igor Sirkovich, and the topic of today's presentation is use of FHIR APIs to fight COVID-19 in Ontario, Canada. A few words about myself. I'm a Senior FHIR Implementation Consultant and Solution Architect. I'm consulting at the Ministry of Health of Ontario, and I'm associated with Small CDR. Also, I'm a co-chair of Canadian FHIR Solution Architecture Group and lead of Canadian FHIR Baseline Medications and Immunization Profiles. And I was also a contributor to Karen Blue Button Implementation Guide. Our objectives of this presentation is to share our experience in the last year and a couple of months of using FHIR APIs for COVID-19 related projects in Ontario, Canada. We have quite a few projects where we use FHIR, and some of these are listed here. It's lab results for public health, patient identity resolution, access to COVID-19 lab data, and immunization data, submission of immunizations, submission of adverse events following immunization, and a new project is a proof of vaccination of verifiable digital credentials. So I will start with a business need for this first use of FHIR. We needed a way to get lab results for all COVID-19 tests into public health, so that public health employees would be able to perform investigations and contact tracing of all cases, and actually to create new cases as well. So we created, actually Ontario Health, which our partners created a FHIR API on top of a provincial laboratory repository that allows us in close to real time to get lab results of all COVID-19 related tests. And we have a logic that based on specific business rules, there is update existing case investigations, so we create new ones. We update status of existing cases, and more recently we identify variants of concern. So most of our implementation guides and FHIR implementation guides are hosted on simplifyer.net. And okay, I will show. So this is a Canadian FHIR registry. So actually it's a Canadian repository, Canadian registry of FHIR implementations in different jurisdictions, different provinces across Canada. And some of this you can see that are related to Ontario. So this is Ontario Laboratory Information System. And this is the API that I'm talking about. It's pretty complex data model, but the API itself is pretty simple. And actually they just say, please give us all diagnostic reports that were issued after a specific timestamp or between two specific timestamps. And all this data gets to us using FHIR, and then we continue this processing of this data for all the use cases that I just described. At the same opportunity, some lab results don't have unique identifiers or good enough unique identifiers for patients, which is a Ontario provincial health number. So sometimes we need to resolve to find health numbers by hospital assigned MRNs or lab assigned MRNs or by demographic data. So for this, we have a provincial client registry that, and EMPI solution that also has a FHIR R4 API, which is also actually available on simplifyer.net, and it has like different EMPI matching and search capabilities. So we are using this, and also when we need to map, if we're missing postal code that is needed to map to public health unit, we have a number of regions in Ontario, and each one of these has its own public health unit. So we use this data from client registry as well. from the FHIR APIs that we get from the provincial client registry. And the same places we have FHIR APIs that we are using now for our patient portal and for patient access to the Ontario lab results. And we have another one for provider access. And it's actually the same APIs that I showed at the start of this presentation. So this one that has different operations for search by a specific patient. So patient query for provider, and we have this defined, documented in this API as well. And patient, as I mentioned, here we have a portal. The patient can go to this portal and access the results using, patient is using FHIR, portal is using patient access FHIR API to get this data from the provincial laboratory information system. And some other work that we are doing is related to immunizations. So one of the use cases for us was to provide access for immunization data, about immunization data to healthcare providers, to patients, to provide notifications to healthcare providers. So for that, we created a new API. It's currently temporarily hosted on my own domain, but it will be moved to simplifier.net in the near future and gets a bit more stable. And one interesting thing about this is that we are using SNOMED-CT codes. In Canada, we have CDC, Canadian Vaccine Catalog, that defines subsets of SNOMED-CT for vaccine trade names. It's not only COVID, it's any vaccines. And all the trade names for COVID-19 vaccines have been added pretty recently. Generic or agent codes as well as, and also like route of administration, anatomical site, reporting source, target disease, and so on. So I can show this. Canadian Vaccine Catalog actually has a FHIR API on its own as well. And it's also available if we go to explore. So we can explore this as, using an API, or we can use UI. And if we go to COVID-19, we can see all the trade names for COVID-19 vaccines assigned in Canada. Most of this have been already approved by Health Canada, but some of this are still pending, like Novavax and Medicago. But Pfizer, BioNTech, Moderna, AstraZeneca, Covishield, and Johnson has been approved by Health Canada for use in Canada. And these are SNOMED-CT codes in the Canadian edition of SNOMED-CT. So this is a bit of a challenge potentially, because it's not an international edition of SNOMED-CT, it's a Canadian edition, but it's very detailed and has all the great information. And the API itself is basically, it's just allows to search by patient for all patients' immunization records. And if I go to our profiles, so the retrieval immunization probably is the most interesting one. And here we can see that we are using this CDC SNOMED-CT codes for vaccine generic code and vaccine trade name code. This is exactly the same codes that are defined in the Canadian Vaccine Catalog. Okay, so similar to this, we have a new API. Actually, we are still building this API for submission of immunization data. And the idea here is that if someone goes to the healthcare provider and brings some documentation about immunizations that they got out of country, and this is not out of province, actually not in Ontario, so this information is not in the provincial immunization registry. So this healthcare provider enters this information into the EMR system, but then this EMR system can submit this data using our FHIR API, and we will add this information into the repository. And this would be important if a patient got only one dose and needs another dose. We'll know what the time lapse since dose number one, or if they got both doses, we'll know that this patient is fully immunized, assuming we're talking about 2-dose vaccine. And so this implementation guide is also temporary hosted on my own domain, but it will be moved to Simplifier. And here we're using bundle transactions, so the transaction bundle, so we actually allowed to submit multiple immunizations in one submission to our system. And we're actually using very similar to immunization retrieval, very similar set of profiles and vocabulary. And so this is a submission transaction bundle example, so that we can actually test our system if someone hasn't developed it yet, but just can use a sample message. Okay, moving forward, another very important topic that we've been working on, very important project, is submission of adverse events following immunization. And again, the idea here is some of this don't get communicated directly to public health. A patient can come to a visit to the healthcare provider, to the primary care provider, and complain about some adverse events. So this healthcare provider will have an opportunity to fill a form and submit this form in the FHIR format, and this actually an application for EMRs, for doctors and nurse practitioners, for the EMRs that they're using. They can launch this form builder, this and this form builder will actually convert data into FHIR and submit to our system. And then again, our public health will initiate an investigation similar to how they initiate an investigation for COVID cases. Here they will launch investigation into adverse event and will actually provide at some point a response back with the results of the investigation. So for this one, we're using a combination location response for most of the form data, but we're also using patient immunization, actually have patient twice and practitioner resources. So everything is submitted as a clinical document using a composition bundle, so that it's a point-in-time document that gets stored by public health. And again, if I'm going to the presentation here, maybe I can go quickly here. So these are profiles that we are using. We have a bundle with a composition, with a number of immunization resources, because some adverse events might not be known. Like if patient got more than one immunization, clinician might not know which specific immunization this adverse event happened due to. So they will submit more than one. Patient question response with all the details about this event. And this is based on a questionnaire. And so this is an example of our questionnaires that we currently have defined by Public Health Ontario. So, and so there's 47 different options, and it just doesn't get rendered nicely yet. So we'll need to go to the JSON file to actually see this. Yeah, so these are all, probably need to make this a bit bigger, all the possible adverse events that we want to follow on different types of pains, nodules, cellulitis, rash, and so on, from pretty light ones to very strong adverse events. Okay, I'm going back. Pro-vaccination, we actually just starting this work, and some of the references we are looking at are smart health cards work and smart health cards vaccination and testing implementation guide on FHIR. And also we've been looking into W3C vaccination certificate vocabulary. Okay, so that's pretty much it for my presentation. If you're interested in any details, all the links again are in the implementation guide. And if you have any questions, here my contact information, my email address, my Twitter, and you can also try to speak to me during the DevDays. Hopefully I will be available. And if you have any questions, we'll have a session for that. So thank you very much, and enjoy the rest of your conference. Hello, everyone. My name is Igor Sirkovich.
Thank you, Igor.
Yeah, thank you. And so I have a challenge accessing my app, so I'm not sure if there are any questions yet.
I don't see any questions in the Q&A on Whova.
So this is an opportunity for people to ask any questions. I have a few minutes left. So please, you're welcome. Maybe in the meantime, while we're waiting, I will just mention that everything I just mentioned is still work in progress. We're building this on the fly as new information gets added and as rules constantly changing, like every week, rules who is eligible for immunizations and new variants and stuff like that. So this is one of the reasons that it's still not very stable, and it's still like some of the implementation guides are not on Simplifier yet, just because it's a constant change, like almost daily.
Igor, that's in answer to Joshua's question in the Q&A.
Oh no, it just was, while I was waiting for the questions, I didn't see his question yet.
Joshua asks, in Ontario, are these FHIR systems actually used?
Yes, so these are used. We have a few consuming applications for some of the systems. So for data retrieval, for access to immunizations, we have a few consuming systems that provide access to clinicians to view their data, and also we have a portal that allows patients to see their data. And then all like laboratory results and client resolution, it's all working like quite a few months already, and it's helping our public health. For adverse events, it's still in a testing mode. It's almost ready to be like deployed to production, but it's not in production yet. And like vaccine credentials they're just starting. It's very early stage, but we have very aggressive timelines, so it should be in production maybe in 1 month, so maybe a bit over.
Igor, thanks very much for your presentation and your time today. Everyone, there is an opportunity to rate this session in the Whova app. If you would please do so. And thank you for joining us today.
Yeah, thank you so much.